Hi everyone, welcome. It's right at 1:30. Can everyone hear me okay?
I can.
Yes.
I think, Allie, are we expecting a couple more? Should we give it another minute or should I go ahead and start?
Just took stuff mute. We're just checking real quick with people who called in.
Okay, so everyone just sit tight, give us another minute here and then we'll get going.
Hey Jenny, we can go ahead and get started. Hey Jenny, we can go ahead and get started.
You're on mute.
Sorry guys, I was trying to, my mute button went away. So welcome to everyone who's joined us for today. I'm gonna just do a quick check. Can everyone see the screen that has a screen? Okay. So just a couple housekeeping things to start with. We're assuming most of you know how to use Zoom and are somewhat familiar with it, but in case it's new to you, across the bottom you have kind of your control buttons, and so we'll be talking, and as we talk, you can leave yours on mute to reduce the amount of feedback because we have quite a few people on today. And then when it's time for questions or when you go to introduce your community, you can unmute yourself. There's also a chat bubble down there, and so you can type something in that and that'll pop up. Everyone can see that. Allie's going to monitor that while we talk, and just know that whatever you say in the chat box will be viewed by everyone. And so okay, I think we'll just dive right in. Welcome to the webinar about this opportunity for communities to submit an application to do the Building Healthy Families. Let's see. Allie, I'm hitting it, but it's not going forward. So you might need to move it forward for me. There we go. Okay, so we're gonna do a quick introduction here. We're gonna talk a bit about what the project is and what Building Healthy Families is, and then we'll get to what we're really all here for today, the details on the RFA, or the request for applications, and the submission timeline. The one item we don't have on here is that we will have quite a bit of time for open questions and answers and discussion at the end. And so if you have a burning question, you can pipe up as myself or Kate is talking. Otherwise, you can kind of wait until we're through with our piece, and we'll have lots of opportunities to take those questions at the end. Okay, Allie, can you move me forward?
You do have control, Jenny. You want to try again?
Yeah, I'm hitting it and it just
went.
Is there just a delay?
It must be, because that's all you.
Okay, that's all me. Great. Sorry, guys. Technology is great, even when we're in different places. So I'm going to introduce our team, and just to keep it simple, because there's quite a few of us, I'm going to do the talking on this, and you have our professional mug shots up here. You can take a look. So I'm Jenny Hill, myself and Kate Heelan. Kate can give a wave there at UNK. We are the MPIs are our technical titles on this, which means we co-direct this effort. I'm located at UNMC. Kate is, of course, there at University of Nebraska Kearney. We also have there in Kearney Todd Barty and Bryce Abbey, I think both at the back of the room there. Of course, Todd, Bryce, and Kate have been heavily involved with building healthy families, both designing the program from its initiation and running it over many years. So we know that some of you on the phone or on Zoom will know those three. Allie's sitting there in the front. She's new to our team. We're very happy to have her on board. She is our program coordinator, so she's going to be someone you will interact a lot with, both during the RFA process, and then if you're selected, she is a person you can go to first if you have questions, and she'll help you. Also, we have Paul Estabrooks. Paul, you want to give a wave? He's here at UNMC with me, one of the co-investigators. And then down at the bottom, we have Chris Wickman and Seyu Michaud, both also investigators here at UNMC. They are our statistician and our cost health economist person. So they really will play a kind of a background role in terms of some of what we need to do for the research piece. Now we would like to hear from each one of you. We know that there are, and I'm saying you, I'm going to use the term community collectively because we've organized and cataloged you guys by communities. And so we'll ask you to go around and take a minute to introduce your community, the organizations that are represented, and a quick kind of name check on who's with you. We know some people have multiple partners, some people only have one person with them today. And to make that organized, Allie's gonna call your community out, and then you can unmute yourself and just say who's here today.
All right, thanks, Jenny. We would like to start with North Platte. If you would like to go ahead and introduce yourself and who's on call today.
I'm Trudy Merritt, and I'm recreation leader for the city of North Platte in charge of aquatics, fitness, and wellness, and the director of the Platte River Fitness Series, which is a community health initiative in partnership with Great Plains Health here in North Platte. And I'm not 100% sure who else from my team is with me.
Awesome, thank you, Trudy. Next, we'd like to go with Gehring.
I'm assuming that's me, Gehring Scottsbluff, is that correct?
Yes, that is correct, Kelly.
Okay, I'm Kelly Betts. I am actually the Assistant Dean of the UNMC College of Nursing here in Scottsbluff. However, I am a practicing pediatric nurse practitioner, and I work with the Community Action Partnership of Western Nebraska, who will be the primary, it will be the location and the primary partner. And we at Community Action Partnership of Western Nebraska have many services in our health clinic. We have our behavioral health clinic. We have some outreach, some WIC. We have all kinds of different partners that we will be integrating into this project if we are selected. So I'm honored to be on the call today, and that's us.
Awesome, thank you, Kelly.
Thank you.
Next, we have Scottsbluff County.
Yes, so can you hear me okay? Can you hear me okay?
Yes, now we can.
Okay. Yeah, so we have Regional West Medical Center and Bristol County Health Department. And with me, I have Terry Allen, who is a community health worker with Regional West. And I'm the County Health Director with Bristol County. And we will be working together with Regional West Physicians Clinic and Regional West Medical Center to implement an outreach. We have pediatricians who see several children and are looking for a resource for this. So we'll be implementing and working through the pediatric office here at Regional West, and then working with the County Health Department.
Wonderful, thank you, Paulette. Next, we would like to hear from Panhandle Public Health District.
Hi, I'm Cherie Ferris with Panhandle Public Health District. All my colleagues are out for the rest of the day today. So it's just me here. We have a diverse array of communities and partners that we work with. And a lot of that is to be determined as far as who we might be implementing this program with. Thanks.
It was very nice. It's very nice to have you, Cherie. Next, we'll have Columbus.
Oh, we lost them. We lost.
Hi all. I am Chuck Seifert. I'm the Chief Public Health Officer here at the sorry, can't talk this afternoon at the East Central District. And I've got Cody Bruns here. Cody will actually be leading the actual program if we are to be selected for this project. Cody, you can talk a little bit about your work in WIC, and we can talk about maybe our sort of broader partners.
Yeah. So WIC CPA. So yeah, see kids all the time. So yeah, I think this would be a really good opportunity just because I see it every day, and out in the community can make a really big difference. I think it's something that was implemented like this because I know a lot of things, and there's a lot of education that is being missed, and so I really think this would be a great opportunity for parents and children. So yeah, I'm excited.
Our partners range from the Y, which I can see from my window here, as well as other community partners that are very interested in this work, as well as several local community coalitions that are focused on this work as well. So just excited to be on the call and meeting all of you.
Thank you so much, Chuck. Thanks, Cody. Now, is there anyone else that we have missed? All right, wonderful.
Oh, I'm sorry.
Oh,
can you hear me?
Yep, now we can.
Oh, hi. I'm representing Grand Island. This is Colleen Hanna-Slikel. I'm the pediatrician at Heartland Health Center and medical director there.
Wonderful. It's nice to have you on call, Colleen.
Thanks. Yeah, we're super excited to be talking with you guys about this. We're working really closely with Grand Island Public Schools, who's implementing the BMI report card, and Central District Health Department has actually pulled together a coalition across the community, Parks and Rec, the WIC office, all sorts of partners that are really focusing right now on childhood obesity in our community. So we are excited to be a part.
Awesome. Thank you. All right, and unless we have missed anyone, we will go ahead and move forward.
Okay, great. Thank you, everyone. I'm talking faster than the computer is moving forward. So we'll give it a minute to catch up, maybe. There we go. I'm going to spend just a few minutes here. This was all information that was provided in the LOI, but we just thought it'd be good to have you kind of hear it from us as we talk about what this overall project is and where your efforts might be fitting into a bigger effort. This project is funded by a grant from the CDC that we're calling the Nebraska Cord 3.0. CDC's funded this under what they call the Childhood Obesity Research Demonstration Project. So that's where CORD comes from. If for those of you who are in public health departments, you can Google, or anyone else can Google this and look at what they've been doing under this initiative. They've had CORD 1.0, 2.0, and then this project is funded under what they call 3.0. The goals are pretty straightforward. It's to increase the availability of effective pediatric weight management interventions for millions of families across the United States. They do have a specific goal of targeting low-income families. So it doesn't have to be only low-income families, but we would like to reach those populations as much as we can. So the University of Nebraska Nebraska at Kearney, so UNK and UNMC received funding to move the Building Healthy Families program into a user-friendly format that can be used to train new communities who wish to deliver Building Healthy Families. So since this is a funded initiative, we do have kind of research aims or goals that we're required to fulfill for the CDC. The first one is to create the Building Healthy Families program and training package that can be used by communities. You guys are all interested in being one of our test communities. That's why we're here today. And we're going to be conducting a mixed methods research study on that package program. So we would like to recruit up to 8 new communities who are willing to pilot test Building Healthy Families and the way we package the training and the program. And then within that, we're going to test 2 approaches to how we might train communities as they use the Building Healthy Families program. So those are kind of our goals in terms of the research study. I'm going to turn it over to Kate now and let her talk about what is Building Healthy Families program. And we know some of you have familiarity with it, but we just want to make sure everybody kind of understands what the program is and what it does.
Great. Well, it's good to have everybody here. Just to kind of give you the background of what Building Healthy Families is it is an evidence-based and a family-based pediatric weight management intervention. So it's really designed, it's an adaptation of an evidence-based program designed for rural communities. And so we have done a lot to make the program really user-friendly to rural Nebraska children and their families. We have seen some great success. We've seen children lose more than 5% of their body mass in 12 weeks, and we've seen some adults lose up to 40 pounds on average. We've seen adults lose 14 pounds in the 12 weeks. And so it's been very evident that as long as we can get the parents to buy into changing the environment, the kids are seeing that change as well. So some core components is we have nutrition education, which is all designed at a 3rd grade level. It's fun, interactive nutrition education. Nothing is rocket science, but I think that's why parents see success as well. It's simple, it's easy to follow. I'll show you another slide about the traffic light eating plan. Everyone engages in a physical activity during the session, which is really more of games and activity. It's not exercise, and it encompasses the whole family. So kids just absolutely love engaging in the activity with their family, with their parents. They think that's fun, and that keeps them coming back as well. And then there's a lifestyle modification component where a behavioral psychologist or somebody who's involved in behavior change helps families to not only set goals, but then to follow through. And so those goals were obviously to change eating habits and also to increase activity as a family. So it is a program that's designed for 12 weekly sessions. And then after the first 3 months or the first 12 weeks, then it goes basically to every 3 weeks. And then after 6 months, we see them one more time before the 1 month mark. And so there's a relapse prevention built in addition to the 12-week program. And so the first 12 weeks, it is once a week, and it is approximately 2 hours each week for the first 12 weeks. We say 2 hours. I'll tell you that we probably really have an hour and a half when we do it here, but people come early and have questions at the end, and so really it is a 2-hour time commitment. And it is family-based, so we highly, highly encourage that everybody in the family attends. So I'll talk about how you qualify for the program, but every child in the family obviously isn't going to qualify, but we want everybody there. We want both mom and dad there. You can imagine if mom's trying to do separate meals for just her and the child, it's not going to be successful. It needs to be an entire family commitment. There is a bullet on here about cohorts. And so a cohort basically is a group of families that we run together.
Yeah.
And so we really talk about a cohort being 8 to 12 families. So you might think, well, that's not very many, but we want the whole family coming. So that puts you anywhere from 20 to 40 people in a room when you have 8 to 12 families. And that's plenty of people to be educating. So I think anything above 12 families is a lot. A typical session, everybody in the family will weigh in. So we have check-in stations when families arrive. They get a weight check, and there's just positive environment. The weight checks, the families are in private rooms, but there's high fives and great job. And if somebody hasn't lost weight, there's just a few comments with the kids, what was different this week. Last week I had kids walking to school every day and we saw weight loss, and then this week we didn't see any weight loss. That's one of the questions we may ask. Did you walk to school this week? Did you take your lunch? And so we really want it to be a positive environment, but there is that self-monitoring. And then they go into about 30 minutes of nutrition education. And then after the nutrition education, there's approximately 30 minutes of lifestyle modification or goal setting. And the curriculum goes hand in hand. So if we're talking about portion sizes, the lifestyle modification will talk about how we can do portion sizes and watch it within the family environment. And so they really complement each other. They really go together. And then everybody in the family participates in physical activity for about 30 minutes. And again, this is all designed as fun, interactive things that you could also do at home, games that you can play together. So these are the program goals. We would like each child who qualifies for the program to be losing about a half a pound to a pound per week. So this isn't a lot of weight at once. It's slow, gradual, but consistent weight loss. Where adults, we'd like them to see about a 1 to 2 pound per week weight loss. Physical activity, we do encourage them to increase their activity by monitoring their steps. And the main thing with this is that they're being active 5 out of 7 days per week. So we don't want to just set a 10,000 per day for everybody and you get a lot of steps on the weekend, which increases your average. We want you to be active every day. And so there's a couple different levels there because it's really dependent on where you start. We'll have some people come in who are getting 3,000, 4,000 steps a day, and other people who are already getting 10, 11. Some kids will be getting 13,000 steps per day. So we know who needs to increase activity and who really needs to focus more on nutrition, but we want to encourage activity every day. And then the nutrition is based on high-fat foods, which are called red foods. And we try to decrease the number of red foods or servings of red foods to 2 a day. And that's kind of the goal. We progressively get to that goal. So the whole nutrition revolves around the traffic light eating plan. And we teach kids and their parents, we teach families how to identify foods that are green. You can eat unlimited. Yellow foods that you should limit, and then red foods are those high fat, which typically are high calorie foods that we want to limit to 2 per day. So can we go ahead and mute if you're not muted, please? So the traffic light eating plan is the foundation for all of the nutrition education. Some of the topics, the weekly topics, obviously we start with teaching the traffic light eating plan. We talk about energy balance, portion sizes, reading labels. You can read through these. We do encourage a grocery store tour within your local community. We talk about how modifying recipes, how to look at designing a kitchen so it's healthy by design. And then we also look at dairy and beverages. So each week there's a different topic for nutrition. With physical activity, again, it's family-based, but we also highly encourage each community to provide some type of wearable activity tracker. And so you know, the more I've looked into these, it used to be, you know, Fitbit was $150 a Fitbit. There are more and more wearable activity trackers that monitor steps that you can get for $30, $40. The kids love them. They're great motivation for the entire family. So it's not investing a ton of money, but it is giving some objective way of activity. Let's see if maybe I can.
Mute all and what?
Mute all. Okay.
Now,
Okay.
Now unmute yourself.
I am unmuted.
Yep.
Okay. So the lifestyle modification, it is family behavior goal setting. We do ask family members to monitor their healthy behaviors. We want them writing down in a habit book foods that they eat, identifying red foods. We want them to record their daily steps. And so we know one of the major components to being successful is self-monitoring your behaviors. And so we have them do that throughout the 12 weeks. We also have them set specific goals for their family, such as, depending on, you know, where their weaknesses are. Is it we need to plan to grocery shop? Is it that we need to plan time for cooking healthy meals so that they're available? Do we need to pre-portion servings and make them available? Is it taking a sack lunch to school? Where can we find activity time? And where can we do it together? So the goals are set based on the individual families. Some of the topics include, as I've mentioned, goal setting, motivation, self-monitoring, stimulus control, reducing access to red foods, and modifying the environment. We do some recipe modifications, so how do we cook healthier? And then we also want to focus on rewards and reinforcements. So how can parents model their behavior and then reinforce positive behaviors of their children? One thing that we've received is feedback. We've done this, we've had 9 cohorts. Actually, we've had 11 cohorts of families go through our program here in Kearney. And some of the information we get back, the feedback, is that families love this program because it's the only thing they do together. Where typically we drop off one child here, we drop off another child here. And this is something that the entire family comes together. And they also have remarked 12 weeks is a perfect amount of time, but they do, it's kind of funny, the last cohort, we had some really nervous families. They didn't want to be done. So the relapse prevention is really important, and parents want to keep that contact. So we've got that built in out to a year. And it's really important that this isn't looked at as a 12-week program. It's really a 1-year program, but the intense week-to-week is in the first 12 weeks. So who qualifies? Children with a BMI greater or equal to the 95th percentile, according to CDC charts, would be qualifying. So family needs to have at least 1 child greater than the 95th percentile. Again, everybody in the family participates, but at least 1 child should be a qualifying child. I don't have it on the slide, mistake on my part, it's 6 to 12-year-olds. So we have had 5-year-old siblings participate and do well, and we've also had 13, 14-year-old siblings participate and do well. But we really find that 6 to 12-year-old age, these kids really buy in the program. They really, they're old enough to understand the traffic light eating plan, and they haven't hit that age where it's not cool. So elementary school age is really what we're targeting. So how do we identify participants? We have worked with area physicians and clinics to do anything from direct referrals to putting flyers in the office exam rooms. Has been very successful. We have also worked with our local schools. Bryce, Abby, and I have created a web application. It's a BMI reporter to help school, the health staff, the nurses, to identify kids who would qualify and also send a BMI report card home to families as a parental awareness program. And we have been very successful on using that as a tool for recruitment. Just to give you an example, I've had a parent tell me that if a school tells them that the child's reading is low, they're going to find a resource to help with reading. When they received a BMI report card indicating that their weight may be high, they wanted a resource to help them. And so it's a good connection with the schools and the community. And then we've also used newspaper advertisements, social media, and to be honest, word of mouth. After our first cohort, I think our second cohort was great just because they've heard from other people. And so we use typically all of those resources. We would provide within the package program that would be provided to communities example letters that can be sent home from physicians. And we also, as part of this grant, if your community is accepted, you would have access to the BMI report card web application for free as part of the community program. I've mentioned before that, I need to move this so I can see this. We've had very good success. Our average age is about 9.5, and in 12 weeks, we've seen BMI Z-scores go down about 0.26, which is clinically significant. We have seen changes in systolic blood pressure, liver enzymes, and good cholesterol increase in the children that have participated over the first 9 years of the program. Also, we have been able to measure body composition to see that not only are kids losing weight at 12 weeks, they're gaining muscle, and that has continued out to 6 months, even though they're not coming weekly. So the lifestyle modifications have worked as far as they've continued out to 6 months. Again, I mentioned this before, but we're seeing parents lose about 6.5% of their body mass, which is, if you know, 5 to 10%, you can see health enhancements. So we're meeting that criteria with our adults. We've also seen enhanced blood pressures and lipid profiles along with liver enzymes in our adults. And so very good results that way. So what does the package program look like? So what we're doing now is we are packaging all of our curriculum and training materials. So if your community is selected, you would actually receive the packaged Building Healthy Families program. And this includes videos, PowerPoints, knowledge checks. It's a train the trainer module. So this is not a program that would be delivered directly to the families. This is a program that would be delivered to your Building Healthy Families staff to train them on how to deliver the program. It also includes all the curriculum, all the handouts and activities, and PowerPoints for you to deliver the program to the families. The package program will also have a data portal where you can keep track of your program data, such as weekly weight loss and the habit books. All of that would be right within the packaged program. So it should be very user-friendly, and I'm kind of using should be. We've developed a ton of it, but it's not 100% complete right now. But what we're envisioning and what our company is envisioning, this is going to be an awesome program to use. Just to give you some examples, this is the what the training guide would look like. So your nutrition coordinator would simply click here and be trained on the traffic light eating plan, the different education components, how you would deliver our portion activity by using rubber bands to imitate spaghetti. The physical activity coordinator would have access to all of the different activities or games that they should implement. Everything is modifiable, but we will encourage, no lines, lots of movement, core components to our curriculum. The program coordinator would also have information about how to set up your weigh-ins, what kind of scale you should have, down to what needs purchased, what is involved in a kit that we would provide your community, with certain specific things that you would need for program delivery. And so it'll be very user-friendly and easy to access. This is an example of what the lesson plans look like. The front page of the lesson plans has a schedule of exactly how the night should go. It has check marks, or what do we need to make sure that we have for each week. And so we've really tried to think through this in an entirety so that it's I don't want to say easy, but it's easy to follow and easy to understand what you need each week. Over here, this is an example of what the website will look like. Each session will have a overview video to watch, as well as downloadable lesson plans, the PowerPoint for education. Everything will be in a single page that's very easy to find the information that you need. So I think we'll keep going and take questions at the end unless anybody has anything. I've muted you all, so.
There's a chat.
But there is a chat. So I'll let Jenny keep going, and then we'll check our chats and go from there.
Sorry, Kate, had to unmute myself there. Okay, so as Kate mentioned, there's, and I realize I skipped over this in the beginning, so I acknowledge that we have partners at UNK and UNMC. We do have a third partner, Trifoya, and they are a digital media company that is partnering with us to create all of this kind of the web interface that we've been talking about. So Kate's given you a really good idea of what Building Healthy Families program looks like. We've given you a preview of kind of the Train the Trainer package that we're building as part of this grant that is a package you would be using. The next piece I'm going to talk about is even though the digital package has everything that you would need to train your staff to do Building Healthy Families and to actually deliver the program to families in your community, one of our goals is to test 2 different training models. And so the package program has everything you need, but we're going to sort the communities we select into 2 groups. One that gets the package program and training, and then the other who gets that plus a learning collaborative. And I'm going to assume many of you have some familiarity with the Learning Collaborative, but it's simply a method or a model in which we bring groups together to have kind of shared experiences and learning. And so what we envision is for some communities, depending on your level of skill or the level of experience you have with doing these types of programs, that a learning collaborative might be a good model for you guys and for us to learn more about what this looks like when we try to deliver it in many different communities instead of just one community. And so the learning collaborative would require the kind of lead organization and supporting organizations to participate in learning sessions. What these would be up to 6 in-person learning sessions. We envision those to take about a half a day in terms of where we're actually meeting, probably 2 to 3 hours, because we're recruiting communities statewide. We would have travel time, so kind of a day of your time, and then up to 4 Zoom types of meetings where some of this we could just touch base as we're doing today. And that's going to be over the 24 months of kind of the project. The learning communities or learning collaborative communities would receive additional funding to cover their costs to travel to those sessions. So we realize that's an add-on, and there would be support for doing that. Just waiting, you guys, for the signal, I guess, to get to Kearney and back down again. It's a long distance out to UNK. There we go. Now it's going forward. So I'm going to talk now about what is required in terms of the RFA. Everybody's been sent the community narrative, and I just want to be clear that we say community narrative and RFA interchangeably. For all of you who apply for funding, a RFA is just a request for funding announcement, shorthand. So that's really what we mean when we say RFA. The community narrative is pretty short. We're asking for about 1,000 words or about 2 pages, and the criteria are outlined. It's the same criteria your application is going to be evaluated on. So first and foremost, and many of you mentioned it today, we're interested in communities where childhood obesity is a high priority. So these are communities that are interested in addressing childhood obesity, and maybe you guys have been thinking about that through some of your local needs assessment or other initiatives that you have going. So that's going to be the first. We'd like you to talk a bit about where childhood obesity fits in the priorities for your community. The next thing is we're going to ask you to talk about your ability to recruit families and how you would reach low-income families. So again, we're not interested in only low-income families, but that's certainly some of who we'd like to be sure is included in your efforts. The next bullet point is to describe who in your community would make up this delivery team. We envision for most communities that's at least probably 2 different organizations, maybe more than 2, and give us just a little bit of information about the expertise or skills of the people that are on your team. And next, we'd like you to describe where you're going to host the Building Healthy Families program or sessions. And really, this is important because, as Kate mentioned, with the physical activity component, you do need to have space that would allow you to do those physical activity sessions with families. It doesn't have to be a gym. Clearly a gym is ideal, but some sort of large multi-purpose space could also fit that criteria. So on 2, 3, and 4, we're really asking you to talk about kind of how you intend to reach your families and bring them to the program, who you're going to have doing the program, and then where you anticipate doing the program. For some of you, you know who these partners are. You have very clear ideas of what these pairings or this team might look like. I know some of you are thinking that maybe you don't know exactly just yet, or you would like to get schools, but maybe the schools aren't quite on board. And I just want to say that's all okay, because you will have a little bit of time to iron that out, but we do want to know kind of what you're thinking now, and kind of that you have an idea of how you would be able to do that. The next 2 bullet points are, we're going to ask you to think about sustainability. So this total grant for us is a 5-year grant. What the community involvement will be 24 months or 2 years. And so ideally, we'd like you to think about how you're going to run Building Healthy Families going forward after the life cycle of this project and this funding. And the last bullet point is your interest and willingness to participate in the Learning Collaborative. So we're going to sort communities into either Learning Collaborative or non-Learning Collaborative. So we want to make sure, A, that you understand and agree that you're going to be sorted into one of those 2. And you can tell us a bit about what might be appealing to for you to participate in the Learning Collaborative. So that's what we're going to require in the RFA. I know it seems like a lot. We tried to keep it pretty short. And we do, we're really just asking for pretty brief descriptions on each one of those. So this piece, the community narrative, is submitted by midnight December 15th. So you have a few more weeks. Sorry again, you guys, I'm just waiting for this to go forward. Okay, so there we are. So it's on midnight December 15th, and then We will review those internally, and our selected communities will be notified no later than January 15th in 2020. So basically, you're going to submit it just before the holidays, after the holidays, and once we're kind of organized, we will reach out and let communities know who has been selected. I'm going to go past the bottom because I have another slide on timeline going forward. The last few slides here, I just want to give you a little bit more information about kind of what support you will get from us. And Kate, is it okay if I just go ahead and talk through this? Yeah, okay. And so we want to be clear that as part of our funding in terms of doing this as a research project, we can support the selected communities for up to at least $5,700 for program startup and implementation of 2 cohorts of building healthy families. So this, all of you guys will recognize this. This is not enough money to actually pay staff to do the programs. The goal here is that you would have partners or your own organization would be willing to support the time and effort by the staff who come together to do this. What this money would support is some of the materials or equipment that you may need to buy or purchase related to doing the Building Healthy Families program. So a Building Healthy Families kit will be provided. We do expect that you would collaborate with the school or the Parks and Rec, your local YMCA, whoever's your partner in that space, to get some of the equipment that would be necessary for physical activity. Other supplies that you may have to purchase include the activity monitors, if you don't have a scale and stadiometer to measure the families when they enroll, and then the weekly weigh-ins, that'll be important. There are some nutrition education supplies, and then of course costs for printing and actually delivering the program to families. We do have the option, if you're interested and you have a school that is an interested partner, we can help you set up on the BMI reporter. That's available at no extra cost to sites. And then for communities who will be in the Learning Collaborative, we have some extra funding that will cover your costs to travel to those learning sessions. So that's kind of what the funding that will be provided to the selected communities. We want to be really clear about what's required of the communities we select. And the first one should be clear. We expect you to use this digital program to train facilitators and to run Building Healthy Families in your community. We are going to ask that you identify and recruit 2 cohorts of families to participate in a 24-month period, and to use the data portal to track required data for the research study. And again, that's built into this digital platform, so it's not something extra that you have to have, but we're going to ask that your facilitators actually use that system. And then if selected, that you would participate in the Learning Collaborative. So I say all of that, and then I want to be really clear that, you know, the research team, myself, Kate, everyone sitting at the table there and kind of on our side, our goal is to help you through this. And so communities will have startup assistance to get you supported. Like we said, this is a web-based application. It's designed to be very straightforward and easy to use, but we're also here to help you with that process. And we will be available to both Learning Collaborative communities and non-Learning Collaborative communities throughout the entire grant process. So we don't want you to feel like you're on your own. Since we're testing this out, we're available to you, and we'll provide some support. Just to give you a little bit of idea, because this might be a question that a lot of groups have, is what are we expected to do by when? So kind of thinking about, you would be notified if you were selected to participate in January. So that's kind of the first marker here. And in February, kind of over the spring, February to May, we would be meeting with each one of the communities. If you don't have all your partners at the table, we'll be helping you finalize your partner list and making sure you have everyone you need on your team. Then kind of not starting until next August would we actually have the digital program ready for you to use to train your facilitators. So what that means is that we don't expect communities would be enrolling their first cohort until January or February 2021. If things go better and you could be ready in the fall, that might be an option, but we do need, the flip side of that is we do need everyone to be started on cohort 1 by February 2021. And then if you're running the program in your community kind of in that spring of 2021, you would just keep doing that, and then communities will have the option to do the second cohort right away in the fall, or they could wait to that next spring and do their second cohort. So I think the real takeaway here is that you will have several months even after we notify you to get set up and to get running, and then to train your implementation team to be ready to start a cohort in 2021. Okay, so that's the last of our formal slides. So we're gonna just open it up for questions, and I think there's quite a few in the chat box, so we might start with those. So I'll just say on the contact information that bhf@nebraska.edu is the email we have set up for this program. Allie checks that every day, and so you can send questions or follow up to that email, and someone will be checking it, and there's a phone number there too if you have questions. So I think I will pause now, and Allie or Kate, do you guys want to run through the questions? Where do we want to start?
I don't think there's anything in the chat that wasn't just simple.
Oh, okay. No,
we took care of as we went. So one of the questions that was whether or not this would be shared. It was emailed this morning, and we will send it again along with the recording. Other questions people have?
I have a question on the narrative. Is that just submitted in a Word document and emailed?
Yeah, Kelly, that would be great. We tried to make it as simple as possible so you guys can just type it up in a Word and then submit it.
Okay, thank you. I have another question, I'm sorry.
No apologies. That's what this is for. Just fire away.
When we talk about the expertise of the people who will be teaching the program, do we need to provide their professional information such as CVs, or just briefly talk about what their expertise is?
It can just be very brief. So you could say they're an extension agent, they're a registered dietitian, they're a nurse practitioner. That's as much as we need at this point.
Okay, thank you.
This is Paulette.
Sorry, I have a question. It's quite lengthy. If we wanted to start in 2020, I'm hearing you say the materials won't be developed. Is that correct?
Not until the fall.
Okay.
Yeah, and so we recognize some communities might be interested in starting earlier. If you're one of those, you can just kind of state that in your narrative, if you will. But since we're developing the digital program, and I think I can go ahead and share this, we anticipate it being ready towards the end of May, and then to look at and to review and then really get this by the community by August. So that is a possibility groups are really gung-ho, but we also don't want community, if this is completely new to you, to feel pressured that you have to start.
Thank you.
I have another question about the train the trainer.
Sure, go ahead.
Sorry. Like what is the time commitment or the length of that program?
So it's, I don't have an exact answer for you. I would say that, you know, if somebody was to sit down and spend an hour to 2 hours going through all of it, they would be able to get through all of it. We really anticipate people will probably take shorter snapshots. The initial training is a little bit longer because we really do go into depth about how it all works, but we've also divided it up. So, you know, your program coordinator wouldn't need to sit through everything. They would sit through their component while the nutrition coordinator would go through their component. So, you know, maybe an hour to go through the initial, and then it's really set up to go through weekly. And on a weekly basis, probably 20 to 30 minutes would be plenty of time to go through everything, get all your supplies together. I mean, it's not super long. At the same time, after doing this, I know the first time you do everything, it takes a little bit longer. So I don't also want to say too short. But it's nothing like we're looking for 5, 10, 15 hours.
Thanks.
We have a couple minutes left if there are any more questions.
I have a quick question. Is there any possibility, we have a clinical integrated network out here that because we'll be working with Great Plains Health, and that's part of them. And is there any possibility that someone from the primary team can come out and sit down with that group and kind of explain the program, because we would, you know, like to use that as a resource for referrals. It's a group of physicians, and so, you know, having someone like yourselves come out and visit with them, I think that would be probably a really positive thing in terms of getting our entire medical community on board.
I'm nodding. I think, Kate, you too?
Yeah, I do. I mean, I think we need to consider this, how we want to go about doing that, but we're also trying to build in here plenty of materials that you'd be able to share.
Okay.
Well. So you could go in and have some slides and have the background and the results. We can too, but they're going to need to be working with you. So okay. I think we could work with you to figure out the best way to get them on board.
Great. Thank you.
Yeah, and I think, Trudy, you bring up a great point for all the communities to, if a clinical partner is going to be part of your team for either identifying and recruiting, it's good to really think about how are you going to bring them on board and how are you going to get them to participate. And I think, yeah, I definitely think we can help with that, and we'll probably just need to talk about what's the best way to do that.
Okay, thank you.
Are there other questions from folks out there?
Can the same person be the nutritionist and the exercise specialist? Can you have the same person doing multiple roles?
That is a great question, and we meant to bring that up. My first answer is yes, but then there's also logistically how we want to do that. So one person could have multiple roles, but to be the nutrition person and the physical activity person wouldn't work, only because we deliver some nutrition to the whole family, and then we have kids go be active while we go more in depth with parents.
Okay.
And so really the physical activity person really needs to be somebody separate, because a lot of times they're going simultaneously. We do some group education and then sometimes just the parents. Now with the nutrition and the behavior modification, that could be the same person if somebody had some experience in both of those areas, because they really complement each other. But that physical activity, it really kind of does need to be just somebody separate because of the logistics of how it's run in an evening.
Okay.
Yeah,
and I could see the program coordinator overlap with one of the educators too. But again, I think any combination excluding that physical activity coordinator.
And I was just going to follow up, Kelly, and say that the way because we've anticipated that this might happen in some communities, depending on, how many people you can bring to the table. So if someone's playing dual roles, they would need to do the training that week for both roles. And that would be really important for kind of program fidelity and implementation quality, as that they actually, if they're going to play two roles, that they have the time to do both training pieces and make sure they understand those elements.
All right, any last minute questions?
Thank you guys, everybody, for joining, and please feel free to email or call. We'd love to answer your questions, help you. This is definitely something that along the ways preparing, we're more than willing to answer questions for you.
Thank you. This was very helpful.
Okay, I think everyone has a Friday in front of them, so we might as well let you get started on your weekend early. And as Kate said, we're here to help. So just if you have a follow-up, please send it. And we're very excited to have all of you thinking about doing this. And we hope that we have that everyone decides to do a community narrative and submit a full application, and we'll go from there. So thanks so much for your time.
Thank you.
Yeah, thank you very much.
Thank you.